Pandemics start with infections that come from animals to humans. These so-called zoonotic infections give a new virus the opportunity to have a new host. Now, if you look globally, you'll see that there are areas where there's a lot of interaction between human and animals, but the frequency has been driven by global warming, climate change, poverty, urbanization, anything that brings humans especially into contact with wild animals, but even with domestic animals. We've been very interested in trying to identify the immune responses that people get when they get those zoonotic infections. Because even if the virus doesn't passage from person to person, the person who got better from a zoonotic infection contains information on how the immune system can fight that virus. As we started looking around the world to try and find collaborators, I was introduced by an old friend who I'd worked with in India years ago to Dr. Sandra Albert, who is starting a brand new Institute of Public Health in Shillong. They're actually doing field research on fevers in the populations that live there, and these are exactly the people in whom you might expect you could detect a zoonotic infection. And so through the introduction, I went out and visited and basically to see what capabilities they have and see what I could do to contribute. Visiting a place like Shillong, it might seem like a cross-cultural interaction, but in a way it's really not, because doctors, scientists, researchers, we're all cut from the same cloth. What is different, though, is the amount of resources that are there for the laboratory component of their school, and because they're just starting out. And so I'm really interested in helping with that. Maybe we can translate some of our technology in there and sort of give them the tools to do this type of research on their own. On the other hand, one of the things we've been long interested in is trying to make technologies that could be done with minimal infrastructure. A lot of the antibody cloning studies that we're talking about here actually take just tens of millions of dollars to build up the infrastructure, but the work that we do here is actually very focused on economy, speed, and really minimal infrastructure. So it would be a dream of mine if we could translate this technology and bring it, show the cell lines, and actually allow them to do this very powerful but fundamentally pretty basic method. I mean, for me, this trip was really important because it fits into the mission here at LIMR. We're making a tremendous increase in our efforts in public health, but the philosophy really comes down from our CEO and president, George Prendergast, who says often we punch above our weight. And that's some of the flexibility we have here as a not-for-profit research institution that has such a global vision. We can be experimental, we can move into, quite frankly, areas of research that might be hard to get funded, but because they really matter.